Hello, and welcome to Patient Registration Process. Patient registration process identifies patient types for registration purposes, lists demographic insurance information that is required for registration process. Understand the process for verifying insurance coverage. We're going to read and apply information on the insurance card. Now, the overview of an office visit. The process of insurance claims. First, you will need to schedule your appointment. The office would need to obtain the demographic information for the patient, allow the patient to register themselves with general encounter forms or super bills. The medical visit, checkout process, enter charge with the procedures or services and diagnoses, generate the claim and submit the claim. Now, let's talk about scheduling the appointment. What information is needed for that appointment? The patient's information, we would need demographic information such as name, date of birth, address, phone number, email address. Insurance information is required. We will also require a front and back copy of the insurance card. That information is very important when submitting the claims to make sure that you're submitting it to the correct payer ID through the transition from your EMR system to the clearinghouse to the insurance company. We will also need the reason for the appointment. It's very important as well. Billing purposes are for that. During scheduling your appointment, billing tips that we need to go over. The information gathered during the registration process is imperative to the success of a clean claim. If information is entered into the practice management system incorrectly, it can result in a denied claim or delay payment. It's actually going to reject the claim. What happens is when we're doing that information and when we're due to transmit through the clearinghouse, it checks all of the data that is listed that was entered into the software program behind the patient. So if anything is off, such as name, date of birth, even such as a digit off of the date of birth, or a digit or a letter off from the ID number or name, or if we have the incorrect name, which is different from what's on the insurance card, this will cause a rejection for the claim, meaning it never left the system. Patient reminders are very important. Always send out reminder cards, send reminder via emails, mail, or text message. Even a reminder phone call is always helpful to stop having those no-shows, or in the case if the patient forgets. This is just something to remind them that their appointment is coming up. Demographic information. What all is included in your demographics? The patient's name, as I said before, home address, telephone number, patient occupation with name, address, telephone number of the employer if needed, the date of birth, social security number, spouse's name if applicable, occupation, place of employment, referring provider if needed, emergency contacts, and health insurance information. Retrieving the information. How do we get it? Send new patient forms to the patient. Have them download the forms from the practice's website, or request the patient to arrive 15 to 20 minutes before their appointment so that they can fill out the necessary paperwork and we to enter it into the system and verify insurance. Next, health insurance information. We would always need the subscriber's information, and always the information that's listed on the card, put it exactly into the system as is on the card. If you don't, you will have some complications in reference for a submission of the claim. This can also cause a denial and or rejection for the claim. Always make sure check your ID number, identification number, or member number, and also if they have a group number if applicable. Always important to make sure you look for the pharmacy information so that we can enter it into the system properly. If not, ask the patient for that information. Also, deductible copay information is very important. We need to know what to collect for the actual office visit and what is the patient's responsibility for the services that will be rendered to them. Next, we need to have, like I said, front and back copy of the insurance card. We need to have a phone number to reach them for claim status or verification, and also the correct information that we're needing to submit the claim. Insurance coverage verification is one of the very most things that causes AR to drop in an office. Is because we don't make sure that we have the correct information. So that's why it's important that we always get front and back copy of the insurance cards so that we can have that correct information available. To verify insurance, this needs to be done every time before the patient comes in to see the doctor. Reason being is because insurance coverage terms, they change group plans. They might change insurance plans. And if we don't have that correct information, we also are causing the claim to not go in as a clean claim, and this can cause rejections or denials. So we must verify insurance through phone, internet, clearinghouse if available. Also have the patient's demographic information, patient's ID, or insurance card information to verify the benefits. You will always need that available if you're making a phone call and using even the portals. They will require that information to get the valid information. Primary versus secondary insurance is important as well. Also can be called a coordination of benefits when both are available. If there's only a primary insurance, there is no necessary need for a coordination of benefits because we will only be submitting the claims to one insurance. Primary versus secondary. Mr. and Mrs. Smith both have family insurance coverage through their employers. Mr. Smith's date of birth is 10/8 of 69. He has Blue Cross Blue Shield, and Mrs. Smith's birthday is January 20th, 71, and she has Aetna. Mr. Smith primary Blue Cross Blue Shield and secondary is Aetna. Mrs. Smith primary Aetna, secondary Blue Cross. Also, dependents children date of birth rule, so that makes it primary of Aetna and secondary Blue Cross Blue Shield. But also make sure that the patient has reported both insurances to each other so that a coordination of benefits can be done. Sometimes patients do not let the other insurance know that they have another insurance, and it causes issues within reimbursement for the claims. So we always need to make sure we know who's primary and who's secondary if there is a husband and wife situation, and or if the patient has two different insurances. Type of Medicare providers. We have Part A and Part B. Part A is for institution hospital only, to gather accurate MSP data to determine whether or not Medicare is the primary payer by asking Medicare beneficiary or their representatives questions concerning the beneficiary MSP status. Bill the primary payer before billing Medicare as required by the Social Security Act. Submit any MSP information on your Medicare claim using proper conditions and accuracies codes on the claim. Medicare Part B providers are physicians and suppliers, other words, outpatient services. Gather accurate MSP data to determine whether or not Medicare is the primary payer by asking Medicare beneficiaries or their representatives questions concerning the beneficiary MSP status. Bill the primary payer before billing Medicare as required by the Social Security Act. Submit an explanation of benefits, which is an EOB, form from the primary payer with your Medicare claim with all appropriate MSP information. If submitting an electronic claim, provide the necessary fields, loops, and segments needed to process an MSP claim. Patient information on the patient registration form. We always need to make sure we get clear written information and or through the software program if they're doing a self-enrollment for themselves. Always make sure to double check information that's listed so that we can make sure everything is correct. When you're making the appointments, each time the patient calls, if it's an established patient, make sure that you ask them, has any of their information changed since the last visit, such as address, phone number, insurance information, email addresses. Those things are very vital in reference to contacting the patient if needed. Also, responsible party information is important as well. This must be filled out to the completion on both areas. Insurance information. If the patient did not give a copy of the actual card, we also need to make sure that the information that's listed on the registration form is correct. Always make sure that we have all of the detailed information in reference to primary insurance, the policyholder's name, social security number if needed, the policyholder's date of birth, the policy and group number, and if secondary information is available and necessary, please make sure that you get that information as well. It's very vital to the actual processing of the claim to cause a denial or rejection. Consent for payment. We always need to make sure that we have consent and authorize consent for payment in reference to getting this information completed. Always make sure that everything is dotted and crossed when you're getting this information. It's very vital in reference to making sure that all of the information is listed correctly. Authorizations. Authorizations are very important when we're having medical records sent from one office to another. We always need to get authorization from the patient to do so. Also, to give any information out to any other person that is not the patient, we must have a signed authorization giving that permission to that person to get any information on behalf of the patient. So it doesn't matter if they're married or not. It doesn't give them the entitlement to give their information. If no authorization is on file to give that medical record or information over the phone in reference for the patient information, we're not able to do so. Must explain, due to the HIPAA laws, we're unable to disclose that information unless there is an authorization form signed by the patient giving authorization to do so. Encounter forms. These are also called super bills. Sometimes you will come across these in certain offices in reference to how the actual visit went, marking the level of the office services, if it was preventative care, if it was a well woman exam, supplies were supplied to the patient, x-rays, office procedures, medications, and other things. These are very important as well because the actual doctor sometimes gives these details in reference for the codes that we're needing to submit in the actual software program. Making sure these are correct when completed, and always make sure double check your work when working them. Medical visit, the provider. Records, necessary documentation. Documentations to include services or services performed and the reason for the services. Charge entry. This is an encounter form to the claim. Enter charges and patient payments for from the encounter form. The previous encounter form that you reviewed should have all of that information, which includes the codes. Balance charge and payments for the encounter form to the system. Payments such as checks and cash should be deposited daily. Charge or charges and diagnoses are listed on the claim form and on the encounter form. And we will generate the claims when all of this detailed information is entered from the encounter form. Claims edit, which is part of the practice management claims edit report. This is an encounter showing all of the information that was entered and possibly showing that the claim was submitted correctly or if there was any information that is needing to be reviewed. Clean claim. The Code of Federal Regulation published by the United States government states a clean claim is 1. A claim that has no defects, improprieties, lack of any required sustaining documentation, or a particular circumstance requiring special treatment that prevents timely payment, and 2. A claim that otherwise conforms to the clean claim requirements for a equivalent claims under a original Medicare. Life cycle of a claim. Claim submission and electronic data interchange, which is EDI, claims processing, claims adjudication, payment, and denials. And that concludes our class for today. I hope that you enjoyed and that you put all of this information in your brain. Don't let it ooze out. Keep it in there. Keep in mind about patient registration. Thank you.